Hello, this is Dr. Stanley Lang, and welcome to this video and this broadcast. This is a continuation of my series on whole person health reflections, and today I'm focusing on physical health issues. And the topic is how to reverse diabetes. Now, even if you're not diabetic, this still might be of interest to you because the chances are pretty good that you're pre-diabetic or you know somebody that's pre-diabetic. How do you know you're pre-diabetic? Well, because if you're overweight, which 60% or more of our population is, you're probably pre-diabetic. So the the story that I'd like to share with you today is a continuation of a story about a patient that I've shared on some previous reflections. And this is somebody who I saw for the first time approximately 6 months ago. And at that time, he was in severe pain and was having almost no ability to walk. He was hurting so much. And his blood pressure was through the roof, and turned out that he was diabetic and he didn't know it. And turned out that he needed to have some major surgery done. And the surgeon said, "Ain't no way we're going to do that surgery till your diabetes is under control." Well, he didn't even know he'd been diabetic. So he was, let's say, motivated to get the diabetes under control, but at the same time, he didn't want to use a bunch of medicine. He definitely didn't want to use insulin. So he was also very open to my lifestyle approach to diabetes control. And what he was able to do was literally lose 20 pounds a month for 2 months in a row, and then 10 pounds for the third month. So literally lost 50 pounds in 3 months without starving himself. No gimmicks, just following a simple program that I have. And his blood sugars basically were excellent by the time he was done with that. And he was able to proceed with the surgery. And I just saw him today in follow-up for the second surgery that he needed to have to fix things. Now, what had happened in the last bit of time is that he had stopped losing weight. Now, he was still eating correctly. He was probably 20 pounds above his target weight, but he'd stopped losing weight. And I wanted to point out that while eating correctly is definitely the key to unlocking the door of insulin resistance and opening that up and letting the body lose weight to burn off the fat. And he was able to do this without any exercise. All of that I just told you about was somebody that couldn't move because it hurt too much. There are limits to that, and this was a good example of that he had sort of plateaued to about where he was going to get without the benefit of exercise. Now, I am 100% sure, without the slightest doubt, that if he stays on the same eating plan, and if he starts doing exercise that I'll start recommending as he's able to do more activity, he's going to be at normal weight. He's not going to need the blood pressure medicine that he's been taking to be able to get the surgery done. And his diabetes will be reversed. So the point being that the key, the foundation of any kind of a diabetes reversal program is how do you eat? And it needs to be low glycemic, very low glycemic ideally. And we've talked about that in other places. And it's easy to learn how to eat low glycemic and still be very satisfied. But at some point, there are limits, and exercise does become critical to ultimately reach your targets. And obviously, exercise is critical for health anyway, so I would never recommend a non-exercise lifestyle for somebody. But this was just a really good example of how you can get pretty far down that path with eating right, but you can't make it all the way without adding exercise in. And ultimately, the long-term solution must involve exercise. So in your own life, as you want to make some changes that are focused on much better health, much lower risk of heart disease, stroke, and all the other bad diseases that you know about, eating right is the key. As one of my friends who is an exercise fitness trainer likes to say, you cannot out exercise a bad diet. And I've seen people try to do that over the years, and you can't do it. And the older you get, the more obvious it becomes that you cannot out exercise a bad diet. So I encourage you to integrate both into your life. They are absolutely as crucial as your right leg and your left leg are. It's to say which leg is more important. Well, they're both critical, right, if you want to get anywhere. But it is true to say that if you isolate out diet alone, you can get a long ways down the path towards your goal, and must do that or you won't get anywhere with your long-term goals if it's exercise, and you're anywhere past that 40-year age mark in most cases. So I wish you well, God bless, and success on your health journey. Have a good day.